Good evening. This is for Informatics and Nursing Quality Indicators, Nursing 440, Assessment 4. Hello, my name is Michelle Driver, and I am a registered nurse and member of our organization's Quality Improvement Council. Our role is to assess the care and services delivered at our facility to ensure that we continue to provide quality and appropriate care to our patients. We use the National Database of Nursing Quality Indicators, NDNQI, to compare our hospital's performances with other hospitals. The American Nurses Association established the National Database of Nursing Quality Indicators in 1998 to continue gathering and building on data from past research and further developing the nursing body of knowledge regarding factors that influence the quality of nursing care. Baker et al., 2021. The NDNQI includes 3 categories of nursing-sensitive indicators. One is structure. This structure consists of the nursing staff, their education level, and skills. The second is the process. The process includes the assessment, interventions, and overall job satisfaction. The third is the outcome of the care provided. The purpose of the nursing quality indicators is to track nursing sensitive quality metrics to deliver structural, process, and results from database insights. Nursing sensitive quality indicators are information reported to the NDNQI. They show what effects nursing care and interventions have on patient outcomes. Some examples of nursing-sensitive quality indicators include falls, healthcare-associated infections, HAIs, and pressure ulcers. National Database of Nursing Quality Indicators, NDNQI. Today's training will address the nursing-sensitive indicator of patient falls. I will be discussing the importance of preventing falls in the acute care setting. Hospital inpatient falls, particularly those involving patients age 65 and older, can result in severe injuries and produce substantial expenses. Baker et al., 2021. Therefore, it is imperative for nurses to monitor this indicator and provide patients with safe and quality care. A fall is an unexpected event that occurs when a patient slips and goes down on the floor, which may or may not result in injuries. As nurses, we must prevent falls at all costs. When a patient falls, it increases their time in the hospital, ultimately delaying their recovery. When providing care, prevention of falls is the best intervention. New nurses must be aware that falls do occur and negatively impact patient outcomes. Although I've never seen a patient fall in my unit, my preceptor could not stress enough that the need to prevent them is considered high priority. When a patient falls, it affects the entire team. It creates a hectic environment and the flow of patient care is compromised. Falls result in countless hours of paperwork, incident reports, and documentation, so the best measures is to prevent them from happening. It is critical to assess your patients thoroughly and take preventative measures to reduce the occurrence of a fall. Implementations that work effectively include non-skid socks, bed alarms, and the room placement closest to the nursing station. Collection and distribution of quality indicator data. Here at St. Monica's Memorial Hospital, we have a clear plan for gathering and using information about patient falls. The interdisciplinary team can record patient demographics and diagnosis data to predict which people are at risk using the Electronic Health Record, EMR. Thorough assessment is done on each patient upon admission, and their chances of falling are added up numerically based on the number of risk factors they have. The computer then generates a specific care plan based on these results. Some interventions may include room assignments closest to the nursing station or the use of a sitter. When falls do occur, each unit collects data and then compares it to the DNQI database to see where we need improvements. The patient's name, demographic, and medical conditions are uploaded into this database. Our goal is to improve our patients' health and well-being, so this information is required to improve the quality of care. Patient falls are avoidable. However, they do cause the patient a great deal of pain and suffering when they do occur. When it comes to patient safety, nurses are the first line of defense. Every year, falls contribute to more than $50 billion to the healthcare costs in the United States, Cook et al. 2022. Patients in the hospital already have compromised health statuses, and falls may extend their time spent in the hospital. Knowing the negative impact of falls in our facility, the interdisciplinary team must accurately record information regarding nursing interventions taken to prevent falls and report it to the NDNQI. Preventing patient falls is key in the acute care setting. Never underestimate your patient's risk of a fall. Patients are often disoriented during hospital stays. The tubes from intravenous therapy and Foley catheters can become tangled, increasing their likelihood of a fall. Beds should be placed in the lowest position at all times. Patients should be on a regular toileting schedule and assisted to the bathroom when needed. Non-skid socks can help patients avoid slipping while walking around. Nurses should document any potential indicators such as muscle weakness and altered mental status. High-quality documentation is an effective way to communicate with other nurses and staff about the patient's risk of falling. Nurses play a significant role in preventing falling through assessments, interventions, medication reviews, and frequent rounds. Nurses must review conditions that increase the likelihood of falling occurring, such as altered mental status and pharmacological side effects. Communication with other healthcare team with meticulous documentation is necessary to minimize falls. With this, we should work together as a team to achieve our goal of providing safe and quality patient care, ultimately improving patient outcomes. Thank you very much.